Emma, you look like someone just told you your favorite TV series got cancelled. What's wrong? Honestly, Dr. Grace, I just found out I have something called endometriosis. And I'm not even sure I can pronounce it properly, let alone understand it. Don't worry, you said it right. And you're not alone, lots of women struggle with it, but many don't know much about it. Let's break it down together. Please do. Because right now, my brain is just going endo what? Endometriosis happens when tissue that normally lines the inside of your uterus, called the endometrium, starts growing outside the uterus. Endometriosis tissue acts as the lining inside the uterus would, it thickens, breaks down and bleeds with each menstrual cycle. But it grows in places where it doesn't belong, and it doesn't leave the body. When endometriosis involves the ovaries, cysts called endometriomas may form. Wait. Outside? Like? My uterus is messy and can't keep its stuff inside? Sort of. Imagine your uterus is like a house. Normally, the wallpaper stays on the walls. But with endometriosis, that wallpaper starts sticking on the floor, furniture, and even the neighbors' houses. Oh no. So my uterus is basically redecorating other people's property. Exactly. Like I had mentioned earlier, the tissue can grow on the ovaries, fallopian tubes, or even the bladder and intestines, mostly organs in the pelvis. And here's the tricky part, it behaves like normal uterine tissue. It thickens, breaks down, and bleeds with your cycle. But since it's outside the uterus, the blood has nowhere to go. Rarely, endometriosis growths may be found beyond the area where pelvic organs are located. Yikes. That sounds painful. It often is, especially during menstrual periods. And that's why endometriosis is a big deal. It can cause pelvic tissues and organs to stick to each other. Okay, let me guess. The main symptom is pain? Because I've been having cramps that make me feel like my uterus is auditioning for an action movie. Yes, pain is a big one. Painful periods, pelvic pain and cramping may start before a menstrual period and last for days into it. You also may have lower back and stomach pain. Another name for painful periods is dysmenorrhea. Pain with sex, pain during or after sex is common with endometriosis. Pain with bowel movements or urination, you're most likely to have these symptoms before or during a menstrual period. That explains why I sometimes curl up with a hot water bottle like it's my long-lost lover. I've heard that one before. Although the seriousness of your pain may not be a sign of the number or extent of endometriosis growths in your body. You could have a small amount of tissue with bad pain. Or you could have lots of endometriosis tissue with little or no pain. Other symptoms include excessive bleeding. Sometimes, you may have heavy menstrual periods or bleeding between periods. Infertility. For some people, endometriosis is first found during tests for infertility treatment. You may also experience fatigue, diarrhea, constipation, bloating or nausea. These symptoms are more common before or during menstrual periods. Still, some people with endometriosis have no symptoms. Often, they find out they have the condition when they can't get pregnant or after they get surgery for another reason. Oh. So it's not just bad cramps. Exactly. That's one of the biggest myths. For those with symptoms, endometriosis sometimes may seem like other conditions that can cause pelvic pain. These include pelvic inflammatory disease or ovarian cysts. Or it may be confused with irritable bowel syndrome (IBS), which causes bouts of diarrhea, constipation and stomach cramps. IBS also can happen along with endometriosis. This makes it harder for your healthcare team to find the exact cause of your symptoms. I had a patient once, Sarah. For years, people told her she just had low pain tolerance. She was even told to toughen up. Turns out she had advanced endometriosis. That's heartbreaking. I've had people say, "It's just your period, stop exaggerating." That's the sad reality. Endometriosis is often underdiagnosed because people think severe period pain is normal. So why does this happen? Did I do something wrong? No, Emma. You didn't cause it. The exact cause isn't clear, but there are theories. 1. Retrograde menstruation. This is when menstrual blood flows back through the fallopian tubes and into the pelvic cavity instead of out of the body. The blood contains endometrial cells from the inner lining of the uterus. These cells may stick to the pelvic walls and surfaces of pelvic organs. There, they might grow and continue to thicken and bleed over the course of each menstrual cycle. 2. Transformed peritoneal cells. Experts suggest that hormones or immune factors might help transform cells that line the inner side of the abdomen, called peritoneal cells, into cells that are like those that line the inside of the uterus. 3. Embryonic cell changes. Hormones such as estrogen may transform embryonic cells in the earliest stages of development, into endometrial-like cell growths during puberty. 4. Surgical scar complication. Endometrial cells may attach to scar tissue from a cut made during surgery to the stomach area, such as a C-section. 5. Endometrial cell transport. The blood vessels or tissue fluid system may move endometrial cells to other parts of the body. 6. Immune system condition. A problem with the immune system may make the body unable to recognize and destroy endometriosis tissue. Retrograde menstruation? That sounds like something from Star Wars. True. But it just means the blood flows the wrong way instead of out of the body. Also, genetics. If your mom or sister has it, you're more likely to. Other risk factors are never giving birth, starting your period at an early age, going through menopause at an older age, having the short menstrual cycles, for instance, less than 27 days, having the heavy menstrual periods that last longer than 7 days, higher levels of estrogen in your body or a greater lifetime exposure to estrogen your body produces, and low body mass index. How do doctors actually know it's endometriosis? Because my journey felt like a detective movie. Diagnosis can be tricky. Doctors look at symptoms, do pelvic exams, ultrasounds, sometimes MRI. But the gold standard is laparoscopy, a minor surgery where they use a camera to look inside. So they literally peek inside to check. No wonder it took me years to get answers. I thought I was just being dramatic. Many women wait 7-10 years before being properly diagnosed. That's why awareness is so important. Okay, the million-dollar question, is there a cure? Sadly, no cure yet. But there are treatments that help manage symptoms. Your healthcare provider will help create a treatment plan for endometriosis based on a few factors, including the severity of the endometriosis, your plans for future pregnancies, your age, the severity of your symptoms, often pain. Medications can help manage the symptoms of endometriosis. Over-the-counter non-steroidal anti-inflammatory drugs, NSAIDs, can be helpful with pain. Hormonal therapies are another option. They can help with pain and with suppressing your menstrual cycle. I am liking the options. With all of these medications, it's important to note that your symptoms can come back if you stop taking the medication, and these drugs are not recommended during pregnancy or if you're actively attempting to achieve pregnancy. Wow. In some cases, your provider might recommend surgery to treat endometriosis. There are always risks to a surgical procedure. But surgery for endometriosis can be an effective way to relieve pain and, in some cases, improve your fertility. The goal of surgery is to remove the endometriosis tissue. Surgical options to treat endometriosis often is laparoscopic surgery, but in severe cases, hysterectomy. Hysterectomy? That's removing the uterus, right? Yes, but it's usually a last resort, especially for women who do not want to birth children. Are there lifestyle things that can help? Because I already have my hot water bottle, Netflix, and chocolate ready. Those are a good start. Exercise, balanced diet, stress management, and enough sleep can all help. Some women also find relief with yoga, acupuncture, or support groups. I think I'll stick with yoga. And maybe keep the chocolate. I read that endometriosis can make it hard to have kids. That's been stressing me. It can affect fertility, yes, especially if tissue scars the fallopian tubes. But many women with endometriosis still conceive, sometimes naturally, sometimes with help like IVF. That's reassuring. Because the internet had already declared me childless forever. Don't believe everything online. In some cases, endometriosis can go away on its own. This can also happen after menopause, which is often related to a drop in the amount of estrogen in your body. Honestly, beyond the physical pain, the emotional toll is heavy. Cancelled plans, missing work, people not understanding. It's exhausting. You are right. Endometriosis can impact your life in many ways, physically and emotionally. While the symptoms can be worse for some and easier for others, the condition is bound to create challenges for you. You may be in a battle with constant pain that prevents you from enjoying your life or having sex with your partner. The emotional side effects can be just as painful, but in a different way. You may have planned for a child, but now have to put those plans on hold as you navigate infertility. Even if pregnancy isn't on your radar and your pain is manageable, you may have to take medication daily or have surgery to treat endometriosis. No matter your situation, the good news is that there are treatment options available. With treatment, many people find relief from the symptoms of endometriosis. That's why therapy, support groups, and talking about it are vital. I remember another patient, Anna. Her partner used to think she was exaggerating. But once he attended an appointment with her and saw the scans, he became her biggest supporter. That's beautiful. I wish more people understood. Emma, okay, let me throw some myths at you. I have heard that having a baby cures endometriosis. False. Symptoms may change after pregnancy, but it's not a cure. I have also heard that endometriosis it's just bad cramps. Definitely false. What about people saying that only older women get it? It is also false. Endometriosis is a condition that most commonly impacts females between the ages of 20 and 40. It can also happen to younger people during their teenage years. Although many people find relief from endometriosis symptoms after menopause, it can still cause discomfort and pain. Wow. So most of what I've heard has been lies. Sadly, yes. You know, this conversation has turned my fear into relief. I feel less alone. And that's the point. With awareness, management, and support, women with endometriosis can still live fulfilling lives. If you're watching this and suspect you may have endometriosis, don't ignore your pain. Seek medical advice. And please share this video, your sister, friend, or colleague might need it.
Subscribe for more health stories.